Our travel clinic within AccessU is one of our most successful and sort of busiest lines of service. We see a range of patients, clients, travelling holiday makers who come into us for assessment to understand what travel vaccinations that they might need prior to travelling, maybe just to seek some advice, or sometimes it might just be needing malaria tablets before travelling abroad. We're quite structured in our patient pathway in that patients reach out to us, highlight where they're going, how long they're going for. We take some basic information from them, and from that we provide remote support in terms of advice on what vaccinations they might be needing, and then book them in with one of our staff. One of the challenges that we definitely recognise is the conflicting advice that's out there for potential travellers. So whether it's a travel company, whether it's travel insurance, whether it's the cruise ship, there's a lot of different people that have different opinions on what should be being taken up as a vaccine or advice-wise. Within AccessU, we are guided by national standards as well as international regulation for yellow fever vaccination centres. So this is standardised care. So you know that if you're coming to AccessU that you're getting the most current evidence-based advice and making an informed choice about what it is that you need prior to travelling based on your own individual medical needs, which we assess at point of booking. Whilst AccessU delivers advice and vaccination services for the general public, for individuals, for families travelling abroad, one thing we've recently looked at exploring is how we can support large groups that are travelling abroad. Because actually a lot of these people are going away for longer amounts of time. Researchers, journalists, cameramen. I previously worked for non-governmental organisations where we're working in the humanitarian sector, and previously would be going for pre-assessment clinics, getting vaccinations, but also upon returning from being abroad for a month at a time, being able to get reassurance regarding post-travel exposures and those sorts of things. We're looking at working with businesses, with corporations that might have small or even large groups where we can deliver these services on site and provide tailored and expert advice to anyone travelling abroad. It's become more and more popular for secondary schools to go on overseas trips for sort of long amounts of time. We've supported schools with private travel clinics where we've been able to provide tailored advice for the trip through the school lead. This has afforded us to go on site to schools and be able to minimise the time that students are taking outside of their school, but also provide reassurance to parents who are obviously anxious about sending their teenagers abroad for whole months at a time.